Here's the UA results, and can you just see those?
Wow, 3 positives. All right, let's go ahead and contact Child Protective Services on these.
Okay.
Thank you.
Hello, this is Amanda. I'm an RN over at Dr. Smith's office. I'd like to report 3 positive UAs that we have for cocaine, meth, and opioids. Okay, thank you.
So, Miss Borden, I found out from Dr. Smith's office that your urinalysis result was positive for opioids. What do you have to say for yourself?
Who, me?
Yes, you.
Well, what happened was I was at this concert, and I think I got one of them contact highs you hear about, because I don't do no drugs.
She tested positive for opioids.
Miss Borden, we obviously have a problem here. Since you are pregnant, and this can do damage to your child, I am sentencing you to prenatal drug classes and an evaluation by a psychiatrist to determine your need for methadone therapy.
Come on!
If you do not comply, I will put you on a police hold. Do you understand?
I don't need any help. It was a contact high.
These are your mandates. Do you agree?
All right. Right.
All right, hello everybody, welcome. I know you probably really don't want to be here, but this is going to be really important for you. This is your court-mandated class on substance abuse while pregnant. Hi, Miss Borden, you're late.
Is this the right class?
Yes, this is the right class. I'm going to need you to take a seat over here, please. All right. Today we'll be talking about the effects of drugs before pregnancy, during pregnancy, and after birth. The 4 drugs we'll be talking about are methamphetamines, cocaine, opioids, and heroin. Some preconception effects for methamphetamines include increased energy, alertness, an intense rush feeling of euphoria, tachycardia, tachypnea. Chronic use can lead to psychosis, paranoia, hallucinations, memory loss, aggressive or violent behavior, anxiety, depression, and weight loss. Cocaine effects on the father can last up to 2 years and has been associated with decreased sperm count and abnormal sperm morphology and motility. With opioids and heroin, there is currently no research to show that opioids can affect the mother's ability to conceive. Some adverse effects include arrhythmias, hypertension, seizures, and hyperthermia. Brain imaging studies have shown long-term users have severe structural and functional changes in areas of the brain associated with emotion and memory, which may be reversible. During pregnancy, effects on the mother. With methamphetamines, it will be similar to when the mother used before conception, so increased heart rate, increased breathing, the feelings of euphoria, increased alertness. This can predispose the mother to preeclampsia, eclampsia, and seizures due to the already increased workload from pregnancy. There's also a risk for severe bleeding with placental abruption and miscarriage. With cocaine, you have the risk for infection, decreased sensitivity to pain, increased hospital stay, anxiety, depression. This can also predispose the mother to preeclampsia, eclampsia, and seizures because of the already increased workload on the body, and the risk of severe bleeding with placental abruption and miscarriage. With opioids, the mother going through withdrawal can be very dangerous for the fetus. It can lead to preterm births. She may have miscarriages, possible stillbirth, meconium passage. Elevated epinephrine and norepinephrine levels are found, and methadone does cross the placental barrier. With heroin, you'll have poor fetal growth, premature delivery, premature rupture of membranes, increased risk of venereal diseases, hemorrhage, spontaneous abortion, and death. Affect the growth and development.
You are stressing me out. I can't.
No. You can't take these pills. Here's the due shot. That's why we're here. During pregnancy, effects on the fetus. With methamphetamines, you have an increased risk for preterm births, low birth weight, placental abruption, miscarriage, fetal growth restriction, and congenital anomalies. With cocaine, you'll have placental abruption, premature birth, fetal death, fetal growth restriction, small for gestational age, defects in the kidneys, brain, and genitals, and the fetus does not receive proper oxygenation and nutrition needed for adequate intrauterine growth and development, and miscarriage. With opioids, the fetus can suffer from withdrawal, abrupto placentae, preterm labor, premature rupture of membranes, perinatal asphyxia, newborn sepsis and death, intellectual impairment, and malnutrition. With heroin, you can have fluctuating intoxication and withdrawal symptoms, risk of venereal diseases, prematurity, intrauterine growth restriction, low birth weight, morbidity, and mortality. Because the fetus cannot metabolize drugs as efficiently as the mother, the effects are more severe for the fetus. Effects after birth on the mother. With cocaine, you have the risk for infection, decreased sensitivity to pain, increased hospital stays, anxiety, and depression. With methamphetamine, it can interfere with prolactin release and therefore will interfere with the production of breast milk, so the mother may not be able to breastfeed. With opioids, the withdrawal from opioids is very dangerous for the fetus. It could have caused the mother to have a preterm birth, a miscarriage, stillbirth. The fetus could have had meconium passage within the mother. Elevated epinephrine and norepinephrine levels are found. With heroin, you have decreased pain control, increased pain sensitivity, difficult IV access, breastfeeding support may be needed. There will be higher doses of pain control that is required, prolonged hospitalization, and there could be coexisting psychiatric morbidities. There are federally funded programs in the U.S. where mother is dosed daily and participates in counseling as well as regular drug screenings. Effects on the fetus.
I don't need this class. I'm out of here. I just can't take this anymore.
That's okay. We'll continue. Effects on the newborn with cocaine include tachypnea, respiratory distress, apnea, possible STIs that could have been transmitted from mother to the baby, difficulty arousing, irritability, excessive sucking, hyperalertness, seizures, low birth weight, smaller head circumference, cognitive and learning disabilities, and behavioral and emotional instability. With methamphetamine, the baby can be born with addiction and suffer from withdrawal symptoms such as tremors, sleeplessness, muscle spasms, and feeding difficulties. Deficits in development may occur in areas such as attention, visual-motor, integration, verbal memory, and long-term spatial memory. Upon brain imaging of children exposed to methamphetamine, there were areas of the brain that showed reduction, which correlated with poor performance on attention and memory tasks. Many newborns will have behavior problems, and as they grow, they have had higher instances of acting out in aggressive or violent manners. With opioids, you can have neonatal abstinence syndrome, which is a disorder of the drug-exposed newborn that can progress into seizures. Irritability, hypertonicity, excessive and high-pitched cry, vomiting, diarrhea, feeding disturbances, respiratory distress, disturbed sleeping, nasal stuffiness, fever, tremors, seizure, and because of the use of opioids, the baby will have to be monitored very closely and have longer hospital stay. With heroin, you have irritability, high-pitched cry, tremors and convulsions, hypertonicity, vomiting, diarrhea, feeding difficulties, retractions, tachycardia, fever, nasal stuffiness, peeling skin, increased Moro reflex, risk for sudden infant death syndrome, and a delay in milestones of development. Here we have a slide showing how the placenta supplies the fetus with nutrients and oxygen, and how the drug would be able to pass to the baby from the placenta. And then we have an example of a baby after birth who could be suffering from withdrawal symptoms. Ms. Borden? Ms. Borden? I just feel the need, I have to let you know that I do need to report to the courts that you walked out of class.
It was just a contact high. Leave me alone.
I want to ask you too.
What's wrong with you? What's wrong with you? Let me alone, Bobby. Go away. I'm sorry. Go. Stop.
I love you. Don't do drugs.
Amanda,
Yes.
I think I'm ready for help.
Okay, good. We'll get you some help.
Okay, I see we're back here for your 90-day follow-up. How has she been doing? Is she attending her classes?
Yes.
Wonderful. Is there anything that you would like to say to the court?
Yes, Your Honor. I understand now the effects that drugs have on a baby and why moms shouldn't do it. And I've been seeking treatment. I'm getting methadone treatment. And I plan on weaning myself off once I have the baby. And I would just like to say that I'm sorry.
Wonderful. I'm glad to see you doing so well, and I hope you continue in sobriety.
Thank you, Your Honor.
Thank you.
Thank you.